everyone. This is Paula Harriss, and I'm excited to be back with you today with Dr. Jacque Russo. And Jackie, we met several years ago, didn't we?
Yes, it's been a while now, Paula, and we certainly do get to keep up on Facebook. I love that. Getting to see all the wonderful things that you're doing in dentistry. It's great.
Well, thank you, Jackie, and you are an amazing person. I mean, I want you to tell just a little bit of your background, but you're a dentist, you're a nurse, you're a nutritionist, you're involved in office design, you're involved in healthcare, you're involved in AAOSH, which is what we're going to talk about today, the American Academy of Oral Systemic Health, which is a fascinating organization. So anything you'd like to share about your story, because it's really amazing.
Oh, well, you're so sweet, and I can't tell you how honored I am to be on your call. I know that you work with some of the key opinion leaders in dentistry, and I'm just honored to be here. But, when you started talking about all the things that I'm involved with, it sounds like I'm kind of a confused person. I can't quite seem to find my direction. But my life has been such an amazing journey. I mean, it certainly hasn't been a straight path. And I think for most people, if we're open to it, it's not a straight path. Right?
Yes, I mean, it's not. I'm right there with you on that. And I wouldn't call it confused. I call it talented.
Well, it's about in 2001, I was 40 years old, a little over 40, and I was faced with arthritis in my hands. I had just really gotten my practice, just humming. It takes about 15 years, to really figure out what you're good at and get the whole business streamlined and get the right team and get yourself educated to where you go to work every day and it's not stressful. And about that time, I got the curse of osteoarthritis in both thumbs. And I couldn't, I tried working, I tried cutting my hours, I tried going, on medication. It made me sicker, everything from going to the Mayo Clinic to figure out why at such a young age I had arthritis, whatever. Finally, the recommendation was we're either going to have to operate on both your hands, and this horrendous surgery was going to be just more than I could even contemplate. And there was no guarantees that I'd ever be able to go back to dentistry after. Mm-hmm. So at that point, I sold my practice, and, for the first 6 months, sat around kind of having a pity party, trying to figure out what do I do now? Because like you said, I'd already been a nurse, which I loved, loved that profession. But at the time when I was nursing, there was a terrible nursing shortage. We were being forced to work 16-hour days, and the pay was miserable. And, it just didn't look like a sustainable, rewarding career for me. Mm-hmm. So that's why I chose dentistry. So now I'm looking at 43 years old, my third career. And it's just, it's just amazing how if you just stay open, God does provide the answers.
That is the truth.
I don't want to get all religious in case there are people, who don't feel that way. But it for me was divine intervention, and that's when I met Harry Demery, and the whole design, the whole office design thing came into my life. And for 5 years, I focused pretty much exclusively on that. But the thing that changed my life the most was in 2010, in October, I got an email from Chris Kammer, who, if your people don't know him, he's the son of Jacque Kammer, Jacque Kammer started the American Academy for Cosmetic Dentistry in 1984. Yeah. And we all know what an organization that is and how it changed the face of dentistry forever, right?
Mm-hmm. Yes, I've had Jacque on the call. I mean, not Jacque, but Chris on the call before. Okay, yes, good. And he's amazing.
Well, he is just the most passionate, enlightened dentist that I've ever met. And when he called me, he said, we're getting a group of people together in Wisconsin, and I want to talk to you all about this concept I have. And on October 15th, 2010, the American Academy for Oral Systemic Health was founded. Mm-hmm. There were 34 of us in Wisconsin, And we all got so excited about hearing Chris talk about how we were going to, as dentists and hygienists, we were going to change the face of medicine by putting the mouth back in the body and talking to our patients about total body wellness.
Wow. That's
I mean,
awesome.
it was for me life-changing, and not just on that day. So fast forward 8 years later, or 7.5 years later, the things that I have learned and the things that I have incorporated into my life based on all of the speakers and the presentations and the research and everything, this culmination of everything we've been doing has changed my life physically, emotionally, my passion for life, my passion for moving from that place of being successful, but into that place of being significant and having a change, making a positive change in the world. I mean, that's become my goal now.
Wow, that's awesome. I mean, you are living fully alive, aren't you?
Well, I'm very grateful that, again, that all of this just found me. I wasn't really out there. I was kind of searching for my purpose, but, it's just it really has changed my life. So the total health model in dentistry, it's time. It's here. It's not the next wave. It's the wave.
Right.
It's the cosmetic wave, but it's of, the 21st century. We have to start thinking about our patients as entire human beings. It's not just their teeth. It's not even just their gums.
That's right.
Because, inflammation is the number one cause of all chronic illness. And oral inflammation is the leading cause of inflammation of all.
Wow.
So, who's right in the middle of that?
Say that again, because that's pretty profound,
Well, so we know that inflammation, and right now I'm studying with Dale Bredesen about Alzheimer's, and inflammation is one of the major contributors of Alzheimer's disease.
Wow.
Well, inflammation is also the major contributor of heart disease, of cancer. So all chronic illnesses, the basis lies in inflammation. And oral inflammation is the most common source of inflammation of them all. Meaning more people have, when we know how many people have periodontal disease, 75% of adults, right?
Yeah.
So that inflammation doesn't stay in the mouth.
Nope.
It travels throughout the body. So here we are in the catbird seat as dental professionals. We can easily diagnose it because you can see it, you can touch it, you can feel it. You don't have to do expensive blood tests. You touch the gums, they bleed. You've got oral inflammation. You've got disease,
right?
Right?
That's right.
And guess what? It's not even that hard to treat.
No.
It's really not that hard to treat. Now, we have to use certain diagnostic tools to first of all, be able to diagnose it appropriately. We have to be trained and understand that bleeding gums is never acceptable. It is always a sign of disease. We have to know what pathogens we're dealing with. So we have to do salivary diagnostics so we can properly diagnose and properly eradicate those very dangerous pathogens. But once we do that, we have cured a major cause of inflammation that is contributory and in some cases causative to these major chronic illnesses that are killing us. So causative, what am I talking about? I'm talking about heart disease. I don't know if you've ever heard Brad Bale or Amy Doneen talk.
Yes,
okay.
I have.
Okay, so they've done incredible amounts of research proving that P. gingivalis is a causative pathogen in atherosclerotic heart disease.
Yeah.
So if we don't cure our patients' P. ginge in their gums, we are basically negligent and contributing to their heart disease. In fact, if you just go in and start root planing somebody and you don't know they have P. ginge and you start dislodging all that P. ginge into the bloodstream and they have a heart attack, there's been legal precedent where the dentist is sued.
Yes.
Yeah.
I've heard about that. It's just scary.
Yeah. Well, it's not scary because we have the tools to diagnose that,
Yeah.
and we have the tools to intervene. And again, it's not hard. It's
Mm-hmm.
not hard to get our patients healthy periodontally. It has been hard in the past. We all have refractory periodontal patients, right?
Yes.
We all have them. And a lot of times we say, well, it's compliance on their part. The patients come in, they go, honestly, I've been flossing, and you look in their mouth and they're still bleeding, and you're like, well, that's impossible, right?
Yeah, right, exactly.
We want to blame the patient because we feel like we've done everything we can. But the truth is today, if you're not doing salivary diagnostics, and unfortunately, in many cases, putting them on a systemic antibiotic therapy, usually a combination therapy, because they might have spirochetes and bacteria. So they're going to need a huge, big load of antibiotics because it's not just in their mouth, right? Now it's in their plaques, it's in their brain tissue.
Oh.
The work I'm doing with Dale Bredesen on Alzheimer's is the spirochetes. The spirochetes that are in our mouth travel and invade our brain tissue. When they get into our brain tissue, the amyloids are formed, and amyloids are an indicator of Alzheimer's disease, right?
Mm-hmm.
So those amyloids are formed as a protective mechanism. When there are toxins or invaders in the brain, then these amyloids form to protect the neurons.
Right.
And so it's a protective mechanism, but it lets you know that there's something going on that is attacking your neurons. And if it's a spirochete that's coming from the mouth, we're never going to be able to get those Alzheimer's patients better either until we get rid of the spirochetes.
Wow.
So we have to test for these things. It's no longer optional. And let me tell you something else that I found fascinating. This happened to me personally.
Okay.
Periodontal disease is contagious.
Yes.
Very contagious.
Right.
So, and you don't always know your patients have periodontal disease. They don't always show up with signs of bleeding gums. So about 5 years ago, I guess. 5 years ago, I have 2 implants.
Yeah.
I was eating an almond, and I bit down on this almond on one of my implant teeth, and I felt something like, that one. And I thought, oh, that's not normal. You're not supposed to feel that.
Yeah.
That's never happened before. And it was an implant I'd had for, I don't know, 8 years or something. It's been perfect.
Yeah.
So I went, and I've been going to the dentist every 6 months because I've never, ever had a bleeding pocket or anything. Just fortunate, whatever.
Mm-hmm.
But so I went in, the dentist probed around. He goes, you got a 10 millimeter defect on the distal of this implant. I go,
oh, my goodness.
I go, well, how's that possible? There's no bleeding. There's nothing looking wrong. So I said, okay, I guess I better do an oral DNA test. Well, it came back, P-Ginge, AA, spirochetes. I mean, I was blown off the chart on my oral DNA test.
Oh, my goodness.
So I'm like, holy crud.
Wow.
How is that possible? So, when you find a patient who's got something like that changed that rapidly, you better start looking around at other family members.
Oh, my goodness.
So we tested my entire family,
Mm-hmm.
and except for my son, who lives remotely and, didn't live in the house,
Yeah.
wasn't around very often, my daughter, my husband, and myself all had the same profile.
Oh, my goodness.
So now I'm thinking, okay, it doesn't really matter where we got it.
Yeah.
But we probably better figure out where we got this so we can, make sure it doesn't come back in my house.
Oh, my goodness.
Yeah, so we all got treated, and guess who infected my entire family? My daughter's boyfriend.
Oh, my goodness.
Yep.
How did you trace that down?
Well, because I said to my husband, okay, are you sharing, are you drinking, eating after anybody, at work? Or I knew I didn't because I'm like paranoid. I don't even like to drink out of cups in a bar, But so I'm thinking, just logically, you go, okay, so I'm thinking, okay, she's dating this guy. He's kind of got, I don't really, like, you know how dentists are, they stare at people's mouths. And I never really thought his gums looked that great, but I wasn't going to get in his face about it.
Yeah.
But then I said, Allie, I want you to test Gary. And we tested him, and he had it, man.
Wow.
He had it big time.
Oh.
So, so my point about bringing that whole story up is, number one, it's contagious. And so if you're treating one member of the family and they're kissing their spouse, and he's already infected, you're never going to get them healthy. So you got to treat the whole family. And number two, it doesn't always appear as a bleeding, swollen gum periodontal case. The presentation can be. So you can't just rely on bleeding gums as your only indicator for diagnosing periodontal disease. That's why you have to do your oral DNA.
That was one of my questions. You know, people talk about probing, and it's really about the bleeding, and then the DNA test. You know, so it's amazing to me, Jackie, that we know that they're swallowing infection, and we know it's contagious, but I just wonder how many doctors, hygienists, clinical team are actually telling patients that you're contagious. You know, you're choosing not to move forward with treatment. Okay, don't kiss anybody, don't drink after them because you're going to give it to them. And, you know, what do you think about that? Do you know that teams are saying this, or are they telling patients that they're contagious and you're swallowing infection?
Well, we certainly teach verbal skills, implementation, you know, at our conferences. And that's why I think, you know, if there's one dental meeting you need to go to this year, you need to come to our AAOSH meeting, because we don't just talk to the doctors about research and, you know, we do implementation, word tracking, empowering the hygienist. The hygienist is the most important person in the practice when it comes to a total health model in the dental practice, because she spends a whole hour there. And, you know, there's so much opportunity for education. And of course, you know, if you told somebody they had a sexually transmitted disease, they pretty much figure out that they better not be sharing that, you know, until they get it cured. So we have to tell our patients that this is contagious. This is contagious, and you're giving it to your kids. You're giving it to your husband. You could be, you know, increasing someone's risk for a heart attack, for Alzheimer's disease. And, you know, should you test every patient that walks in your practice with an oral DNA test? Maybe that's not practical. But, you know, just by doing your health history, I think, you know, if there's anybody in the family, mother, father, certainly parents that have had periodontal disease, that would be an indication to test, because it's passed down, you know, from birth. You know, from birth, the mother transmits, especially the mother, you know, transmits these infections to the baby, and then they live with them for their whole life. And then usually at some point in their adult life, you know, when things get to that tipping point, then it can appear as frank disease. So, so it's pretty fascinating. And what we have found as far as dental practices embracing this total wellness model is if the team and the dentist themselves haven't embraced it in their personal life, then it's impossible for them to teach it, sell it, promote it, be passionate about it.
Oh, you're hitting home now. Right.
I'm hitting home with all the things that you teach, right?
Well, yes, and you know, these verbal skills that we were talking about just a minute ago, absolutely. I tell hygienists that all the time. I said, you know, you've got to tell the patient they're contagious. You've got to tell them they're swallowing infection. What do you think that's doing to the rest of your body? But you're right. If the hygienists themselves, I mean, I know a hygienist. She was my hygienist for a while. She moved on to a different area, but she came to the AAOSH course, and she came back, and she changed her life. She lost a lot of weight. And I said, what are you doing? And she said, well, we went to this course and we learned about oral DNA, and I got tested, and I found out I have some things going on, and it's changed my life. So that's exactly what you're saying right here, I believe, right?
Totally. That's exactly what I'm saying. Until these things, you know, hit home to you. And I'll never forget when I had adult ortho, I test. I mean, I looked at everybody and wrote down their class 1, class 2, class 3, whatever. But I wasn't like a disciple of adult ortho until I had it myself and realized how it changed me. So I think it has to become a personal experience. And here's what I know: dentistry is one of the sickest industries. I mean, dentists and hygienists are sick. Oh. It's a tough business. We work, ergonomically, we're a disaster, right?
Yeah.
So musculoskeletal issues, we are one of the highest professions.
Yes.
Toxins. How about toxins? How about all the toxins that we're exposed to on a daily basis? Now, I'm talking about mercury, of course, but what about if these pathogens are contagious? How many of them are getting sprayed all over us every single day? So, what about our stress level? We know how stressful it is. Stress is one of the 5 big killers behind exercise, nutrition, sleep, toxins. So stress. Exercise is another one. How many dentists, I know I tried to exercise, but you're working all day. You come home, you're in excruciating pain. All you want to do is lay on the couch, have a glass of wine, maybe get a massage. But, a lot of us don't exercise like we should. Right. And then nutrition. How many of us take the time to eat a healthy breakfast, a healthy lunch? If you're lucky, you have a wife that you can go home to who's going to fix you a healthy meal. But so you add all those things up, and man, dentists are on they're heading down the path of destruction. And I really believe that all of those factors contributed to my early disability. I really do believe that. Now that I know what I know, I'm sure of it.
Yes.
Yep.
I see it too. I see doctors working through lunch. Staying late. I have trackers with how many hours they're working a day. I'm seeing 9.5, 10. It's stressful and it's hard on your bodies. And I've had 6 clients this year with neck and back issues, and oh my goodness, it's really scary because it affects your livelihood. It affects everything.
It affects your livelihood, but it affects and steals and robs your joy of life. I mean, it's why there's so much burnout in our profession, because we give. A patient can't open their mouth, so we bend over and stand on our upside down tiptoes to try to, we sacrifice ourselves to give all of what we give, all the therapies that we give. And it's this basic principle of you can't help others if you're not helping yourself first.
Good point. Yep, that's exactly right.
Put on your own oxygen mask first, right?
Yes, absolutely.
And that's what I find in dentistry. In fact, I was talking to Tom Neighbors just yesterday because he's had an epiphany. He has decreased his arterial age, and at AAOSH we do the carotid intima media thickness. It's like an ultrasound of your carotid artery, and it tells you how much plaque and what type of plaque you have built up in your carotid arteries, and it's really a more accurate indicator of cardiovascular health than those stress tests and just about any other test you can do, honestly.
Yeah.
So we do a whole bunch of health screenings at our annual event, and it's one of the reasons why it changed my life so much, because there's so many great tests, and so it gives you a lot of insight into your own personal health, and maybe that's what your hygienist experienced.
Yeah, I believe it was, because she went to the annual event, and that's when she was tested. Just what you're saying, exactly.
So we do nutritional screening. We do HSCRP, insulin, blood sugar, oral DNA testing. We're joining this year. I'm really excited about this conference because we're joining with 2 other organizations. One is the American College for the Advancement of Medicine, and it's a group of more medical practitioners. Finally, we're collaborating better with the medical community.
Yes, I heard about that. The nurse practitioners being trained to be in dental offices. Yes.
Yeah, and so that whole group, naturopaths, nutritionists, chiropractors, some MDs. So it's more of a medical group. And then we've also partnered with the American Academy of Physiologic Medicine and Dentistry, AAPMD, and they are a oral myofunctional and airway development sleep medicine group that has really done a deep dive into that whole field. And, that's another huge field in oral systemics.
Huge.
Really, really important from, early childhood development of airways all the way up through adult and sleep apnea and all the impact that those things have on our total body wellness. And once again, dentists are in the epicenter of early detection.
Yeah, I'm hearing that the ADHD now, they're relooking at that as airway issues or sleep apnea.
Airway and sleep, absolutely.
Yeah.
I mean, finding Connor Deegan is one of the most, I get goosebumps even telling you this right now. Finding Connor Deegan, Deegan, look it up on YouTube. It's a short little video that the mother tells the story of her son and how he had so much trouble in school. And, he was this rotten kid and he was always in trouble and did poorly in school. And she just knew it wasn't her kid. And they finally, a dentist, finally diagnosed him as having this, restricted airway, all kind of sleep issues, corrected those. And now her son is, back. He's perfect.
That's amazing. Oh.
I mean, it gives me goosebumps. It really does. And those are the things that we can do in dentistry that change us from being a successful dentist, meeting our production goals, giving our teams bonuses, going home at the end of the day and, whatever, to becoming significant in your community because you're saving lives, you're changing lives. You're doing something so much bigger than that.
Yes, absolutely. That's that positive influence in the world, really. I mean,
exactly. And I don't know, I think you have to be maybe a certain age. You're starting to maybe be on the back nine of life. And so you're looking back and thinking, what have I really done or whatever. But for me, this is what it's about. It's about, leaving a footprint in some way positive, to make our world better than it was before. And,
absolutely.
It's hard to keep up with everything. There's so much in dentistry we have to be good at. We need to be thinking more total body. Well, that means a lot of things, right? How am I supposed to know? How am I supposed to know everything? And that's our message. Don't try to be everything.
Yeah.
Just find one thing that really excites you.
Right.
And then go with that.
Yes.
And be the best you can be at that.
That's good. That's good advice. Very good advice. And you have to find, you have to still be a good steward of your gifts and your talents, but yet find that passion for yourself and niche. I mean, niches, riches and niches.
Well, you're absolutely right.
Yeah.
You're absolutely right. And I just think, even if you one small thing that a lot of our practitioners are starting with is bringing nutritional counseling into the office.
Yes.
And, you'd have to have a hygienist who was open to that because she's going to do the heavy lifting in that area because she's going to be doing the majority of the educating.
Right.
But there's a medical technology out now that's very inexpensive that you can implement this program into your hygiene department. You take their blood pressure, you do a nutritional screening, takes 30 seconds, costs $1 for the practice to do it.
Wow. And
you get a snapshot of the past 90 days of this person's, basically, it's like a nutritional lie detector. Because if you just do dietary intake questionnaire, how's your diet? Oh, it's good.
Yeah.
What does good mean? Are you counting ketchup and French fries as vegetables?
Exactly.
But this little screening tool gives you an idea of what their antioxidant status is, which is a really important indicator of inflammation in the body, oxidative stress in the body. And how does that correlate with dentistry? Well, if you've got a patient whose nutrition is in the garbage can, they score like in the F zone, the red zone, you're going to have a much harder time resolving the inflammation in their mouth.
Wow.
So is that important to
Yes.
know as a dentist treating their oral infection?
Yeah.
Pretty important, right?
Absolutely.
Pretty
yes.
important.
Definitely.
And you don't have to be a nutritionist to help them with a few resources to understand the foods that are important to them, maybe recommend some pharmaceutical grade supplements,
Yeah.
help them to fill the gaps on days when their diet doesn't provide what they need.
Right.
So some very simple strategies, and guess what? They can be profitable as well. They don't just have to be something else you have to do that doesn't improve your bottom line.
Exactly. And this has been a great marketing tool as well because for example, my dentist who's been through AAOSH, and he said that he had a patient, for example, who could not get her diabetes under control. They were just having a really hard time. She went through the perio program, and she got her diabetes under control. Well, her doctor was like, wow, what have you done? What's the big change? And so he starts sending patients to the dentist because
that's right.
He's seeing that turnaround. Are you seeing things like this happening?
Oh my gosh, absolutely. We have studies showing that when you clear up the periodontal disease, the inflammation in the mouth, you decrease major biomarkers like HSCRP, high sensitivity C-reactive protein. That number can completely go away. And that's a big deal. That's a big biomarker for diabetics. When their HSCRP is high, we can lower their hemoglobin A1C by reducing periodontal disease.
Nice.
We reduce their risk for stroke and heart attack by 500%.
Wow.
When we get rid of, we reduce their risk for Alzheimer's disease by at least 500%. By eradicating those periodontal. So this is huge. These things are huge.
It really is. I mean, it's a no-brainer when you get these facts and you get this information. It's really a no-brainer. I think the number one thing, in my opinion, now you may not agree with me here, but the number one thing that stops us, in my experience, is approval addiction. It's being afraid to tell that patient the news, because they're not going to like us, and they won't come back. They don't believe you, whatever. I mean, do you deal with that, Jackie? I mean, I deal with that every day.
Well, and I think yes, I 100% agree. I feel like dentists have such, and it makes me very sad, such a fragile ego because they've been rejected so many times, and they don't feel honored and revered. They're just a dentist. They're just a dentist. You go to the doctor. Oh, what kind of a doctor are you? I'm a dentist. Oh,
I hate the dentist. Yeah, that's all.
I hate the dentist. Everybody hates the dentist. I'd rather have a baby, whatever.
Right.
So I do believe that but here's what I know for a fact. If you have a personal life experience, you can stand up naked on a mountain and be able to shout that to the world. And so start with your own. The place to start is with your own health.
Right.
Be the proof. Be the change that you want to see in your patients. Start with you. Start with your team. Do the testing. Walk the talk with your team.
Yes.
First decide to become a total health office.
Yes.
And then it'll be easy. You will be so amazed at how many people are out there like me looking for a functional dentist, a functional medicine practitioner.
Oh, yes, functional. That came up. One of my clients just sent me Mark Hyman's new book about food, what to eat, and he's talking about finding a functional doctor, functional medicine doctor. So that's a buzz right now.
That is a buzz, and guess what? All that means is it's somebody who doesn't ask, what do you have? You have periodontal disease. They ask, why do you have that?
There you go.
Why do you have that? Is it hygiene? Is it diet? Is it microbes? What is it, your immune system? Do you have diabetes? What is the root cause? Good. And that's where we have to go. We have to go to that root cause.
That's good. That's excellent. That's what we need. we just put Band-Aids on things, and we're not really getting down to the root cause of it. So, man, you and I could talk all day, and I have said wow about 50 times on this call because you just have amazing information, and it's exciting. So how can we hear more? You mentioned your annual meeting. When is it?
So it's November 8th through the 10th. It's going to be in Las Vegas this year, and I know half the people on the phone will go, oh, Las Vegas, because that's the way I feel about Las Vegas. But it's easy to get to. It's relatively inexpensive, and we're not staying at any of the big hotels on the Strip. We're out in Red Rock. So it's away from the Strip. It's a beautiful resort. There's, lots of zen out there. There's horseback riding. There's beautiful mountains. There's, all of our events are very much designed to be all healthy eating. The food, we make all paleo food. It's incredible. It's almost worth going just for the food.
Wow.
The speakers talk about, and you can go on the website, www.AAOSH.org, to see all the speakers. But this year, like I said, since we're partnering with these other groups, there's going to be different tracks, and you'll be able to choose things that interest you. Let's say you just want to get started on your own track to health and wellness. Maybe you do some of the nutrition and stress management and whatever. Or if you want to bring your whole team, and I strongly encourage that people bring their whole team because this is life changing, and if you want to change your practice, you have to change everybody's lives. But there'll be implementation workshops. On Thursday, we're going to do some TED-like talks with key opinion leaders in the industry, and so you'll get a little flavor of what's the latest, greatest in lots of different areas, and from there you can figure out what excites you. So
wonderful, man! That sounds like an awesome event.
Yeah, it's usually really fun.
Absolutely. So, Jackie, if someone has a question for you, what would be the best way for them to reach you? Do you want people to reach you? Would that be okay?
Well, absolutely. Yeah. Oh, as the president this year of AAOSH, it's my job. It's my passion to introduce, these concepts to as many people as possible. So why don't you share with them through your email? Yes. Give them my email address.
Okay.
You can also give them my cell phone number. Just, ask them if you could text me, or just leave a message, a good time where, we could get our schedules, hooked up so that we could have a meaningful conversation. But yeah, I would love to meet anybody who's interested in these things.
Okay, wonderful. Well, I just really appreciate you making time for us. I'm really passionate about what the messages that you have to share and the differences in people's lives and practices that you're making. And big fan of you personally, and also of AAOSH. So, I'm just knocked out with your willingness to be so real and open and share your own story and give us your time today. So thank you so much, Jackie. I wish you the best.
Thank you, Paula, and I just admire and honor all that you do as well. I'm a big fan of Paula Harriss. Keep up the good work.
Well, thank you so much. It's an honor to do what we do, isn't it?
It sure is.
All right. Take care of yourself, Jackie. We'll talk with you soon.
Have an awesome weekend. Okay.
Bye-bye.
Bye.